as we know that women is the back force of our household, and orthopedic deficiency and this kind of diseases is very common in women. So what is the main reason of this? Everyone's relate this thing with their pregnancy. Like women have pregnancy, that's why their bone gets very weak. They have this kind of deficiency. So I just want to break this myth from you. Like, what is the real reason of this deficiency in women? And how can the women who are listening to us can eradicate this problem from their life?
There are several problems that poses women to have more bone and joint problems, especially in our part of the world.
Yes.
The main reasons are their long hour of working in the house in several postures. They are also cleaning the floor, they are cooking, standing for hours together. Somebody has a house where they have to come up and down 10, 20 times a day, putting a lot of stress on the knee. Plus, in our houses, this is a common trend that suppose a family has limited financial resources. They buy, for example, 1 liter of milk.
Yeah.
The tendency would be to give that milk first to their children and husband.
Yes.
And if anything is spared, then
the women take it. Otherwise,
so they ultimately they work maximum, but they get poorest of nutrition.
Yes.
Right? And that causes deficiency in the bone. Then a lot of women have hormonal problems like thyroid problems, where hypothyroidism causes obesity. They also have deficiency of estrogen hormone if they have hysterectomy or if they have menopause, which usually in India happens about 10-15 years before the Western world. So in the age of 40-45,
women gets menopause.
So that causes estrogen deficiency. Estrogen is the main hormone in women which keeps the bone strong.
Okay.
And if it is not produced, ultimately they get osteoporosis and osteoporosis related fractures. Very common.
Yeah.
Osteoporosis, for example, in post-menopausal women is 7 to 8 times more than equivalent age in men.
Oh my goodness, this stat is very drastic.
Yes.
So that's the main reason why women have more orthopedic deficiencies and diseases than men.
Correct.
I hope now our listeners will be very clear about that. This is not related to only pregnancy. There are a lot of things, like sir said, it's on household chore duties. The second is hormones, and the third one is the way they do. They always feed others first, and if something is left over, then they take it. So women is the only human, I believe, that they always put other first and then take whatever is left for herself. So let's talk something technicality, sir. There are a lot of new things like regenerative therapies, 3D mappings, and robotic surgeries. So how these new technologies have aged your practices than the traditional methods?
That's a very good question. Orthopedics and trauma surgery and care has improved significantly in last few decades. I'm practicing now almost for 40 years and I have seen dramatic change. And orthopedics is one of the fastest moving branches in medicine as far as innovations and new techniques are concerned. We are now moving from reconstructive medicine or reconstructive surgery to restoring the normal anatomy of the person. Meaning thereby, instead of reconstructing a damaged part, we want to regenerate.
Okay.
So if somebody has arthritis, instead of replacing a joint, we prefer initially to preserve the joint by doing certain treatment like stem cells, like PRP injection, hyaluronic acid injection. There are several nutritional supplement, what we call nutraceuticals, that can help in preventing the joint for quite a number of years before actually surgery is required. So that's one part. Then if somebody requires surgery, then there are lots of innovations, like minimally invasive surgery, endoscopic surgery. Then we have various type of newer joint replacement therapies.
Newer joint replacement?
Newer,
okay.
Where we have significant advancement in the metals which we used. We are now also moving from stainless steel and titanium to other metals like PEEK and other metals.
So these metals are beneficial for our health?
Yes.
So the research must have been done. So what is the percentage of previous metals and these metals?
These metals are equivalent or better as far as durability is concerned. Means they can last for years together.
Wow.
They are bioinert. They do not cause any allergic or abnormal reaction in the body if they implant it.
Okay.
They are lighter.
Oh,
but
wow.
They are equally stronger.
It's a great thing that they are lighter and they are equally stronger. So it is giving the best thing, whatever the human needs.
And now the technology is advancing so fast that we have smart materials.
Smart materials, what do you mean by smart materials?
Smart materials means if you replace a joint of a person using smart technology, the joint can tell the patient or the doctor if there is any problem happening inside the joint.
Wow.
Before even patient or doctors knowing or getting any investigation.
Wow. So we are doing the investigation very before than just knowing the reason.
Correct.
It's a very great technology. And what's the there must be a very success rate of this. So how it is going in the daily life?
Now we are actually focusing more on personalized medicine.
Okay.
And customized material that are being used. Meaning thereby there are several procedures that you do as per patient's requirement or body anatomy. For example, we are using robotic surgery for joint replacement, where exactly we know how much bone we need to cut before the operation, and minimal bone resection is required, minimum of soft tissue handling is required. So accuracy is almost 100%.
Wow, that's great.
So you don't leave it for human error to happen.
Yes.
And patients get longer life of the artificial implant, for example. They recover much faster, they bleed less, they have very little pain. So all these advances have actually helped in advancing the surgery.
The way you said, it means it's a foresight. Like people is just doing the whole surgery before implementing it on a human being.
Correct.
And it is making the whole human error a zero thing. And it is making the success rate of the surgery to 1000%. I'm not saying it 100, but 1000%.
Another technology that is helping us is 3D printing.
Yes.
In 3D printing, again, we do virtual planning before the actual procedure.
Wow.
Make templates, make jigs, make implants before surgery, and then perform the surgery using that. That reduces the time significantly, gives accurate results, wonderful fixation of fractures, for example, joint replacement, and unbelievable.
That's tremendous. After knowing such kind of innovations which has taken place in our society, and it is doing the great for the people and for the human being. So my last thing to know from sir is that I have one myth. Like everyone says that cracking knuckle is very, very, very bad for our bone. So would you like to burst this myth for us, sir?
Yeah, a lot of people have the habit of breaking the knuckles.
I also have.
That is usually a habit and it can be a sign of nervousness also, anxiety.
Oh.
Right? If somebody is under stress, they tend to do that.
To release the energy of their body, of an anxiety, some kind of things.
Correct.
Okay.
I do not recommend people to do that because that can cause permanent damage to the joint. That's an abnormal movement that you're doing. And if you do that, little bit of vacuum that is present in the joint gets released and you get satisfaction if you hear a noise.
Yes.
But that's not a nice thing to do.
Okay. So that's all with Dr. Vaishya. It was a great experience knowing all the things which you people have. And if you have any other query, you just comment on our comment box and we will let you know from Dr. Vaishya. And if possible, we will definitely let you connect with Dr. Vaishya for the future things. So thank you for coming at MedGate Today podcast. And it was great pleasure for having you and getting all the little things which we, a layman people, have. And you just clarified all the things very simply in a decoded word. Thank you for coming here, and it was our pleasure to host you. Thank you.
Thank you for the opportunity. I really enjoyed interacting with you, and I hope that I could convey some tips to your listeners that may help them in overcoming.
Definitely, sir. We will do it in the next episode. Stay tuned, guys. Thank you so much.
Thank you.